Hello, it's Dr. Rhonda Johnson. Today is Thursday, February 2nd, 2023. And today I'm talking about the COVID pandemic and asking the question, is COVID-19 endemic? Well, we know the SARS-CoV-2 virus shows no signs that it's dying out, which brings up the question, when will the pandemic end? Will COVID-19 ever become endemic? Well, first, let's review the concept of the pandemic. During a pandemic, there are surging rates of infection, and usually there are mass efforts to restrict the transmission, such as mandates for masks, testing requirements for travel, vaccination campaigns, and/or mandates, etc. Now, let's look at the concept of endemic. Endemic means the virus has a constant prevalence and is fairly predictable within a geographic area. So, for example, malaria is endemic to certain countries in Africa and some parts of Haiti. Seasonal influenza is predictable to a certain extent in the United States. And we have methods to reduce its transmission. So key to the concept of endemic COVID is the ability to reduce and control its spread. Now, we've seen waves of these highly transmissible variants and subvariants, and we have yet to predict and effectively control the spread. So in my opinion, I don't think we've reached an endemic state for COVID. Now back to the pandemic. When and how does the pandemic end? Well, folks, it's not that simple. Experts say it's not just about infection rates or epidemiology. Experts say the end of the pandemic is a social phenomenon. Experts say a pandemic ends when the public thinks it's over. Well, here in the United States, our public health emergency ends May 11th. Most of all of the 50 states, if not all, have ended their public health emergency declarations already. President Biden, in his infamous 60-minute interview in September, said, and I quote, "The pandemic is over. We still have a problem with COVID. We're still doing a lot of work on it, but the pandemic is over." Now, I'm just an ordinary, everyday citizen. I've never held an elective office, but in my opinion, what the President of the United States says matters. It helps set the mood of the nation, whether we agree or disagree. So, pandemic is over, folks. We still have a problem with COVID. Now, whether I agree or not, I recognized a shift has occurred. And yes, sadly, having a problem with COVID means people are still going to get infected. There's going to be excess deaths from COVID, and all the long-term implications of the COVID pandemic, including inequity, long COVID, will play itself out because we still have a problem with COVID. Is the public still at risk? Yes. So what should people do? I've emphasized through my advocacy the importance of having a plan. And I'm just going to share my personal plan now that the quote pandemic has ended. I certainly understand what the virus can do. I'm not naive. I've had COVID. So my personal plan as the pandemic ends is as follows. I'm going to keep my boosters updated. I will be wearing my mask indoors when I attend high-risk events such as concerts, travel, shopping, especially when community transmission levels are high. I will maintain good hand hygiene and optimize ventilation. I'll do gatherings outdoors more so than indoors when possible. I'll be continuing to do routine disinfection and trying to achieve the best state of health and wellness possible. And if I get COVID, or I will take a Paxlovid, or if there's another antiviral, I'll take it as soon as I can. That's my plan, folks. That's as we transition to this end of the pandemic. I hope you get your plan together to help avoid any mental angst that you may experience. That's my message today. Be careful and be well.